Hello, this is Vaping Resources for Healthcare Providers, provided to you by Lorain County Public Health. Welcome and thank you for joining us today. Today's agenda includes an introduction, what are e-cigarettes, what are the effects of e-cigarettes, information about how to talk to patients and parents, and the resources available for quitting. A brief introduction. Who are we? We are Lorain County Public Health, your local health department serving the Lorain County area. This presentation is intended to share resources specific to vaping for youth here in Lorain County. The content of this presentation may be useful when youth patients have identified e-cigarette or vaping as an issue. What are they called? E-cigarette use can be identified by youth in a variety of terms, including those identified here in this list. The most common names are Juuls, vapes, and pens. Who uses them? These are the results of the 2018 Pride Survey of Lorain County youth. According to this self-report survey, 37% of 12th graders have used e-cigarettes in the past 30 days. There isn't a quote-unquote type when identifying e-cigarette use in youth. Using e-cigarettes is so common that any kid can have access, no matter if they fit the typical smoker type or not. Here are some recommendations for how to talk to youth patients and families when e-cigarette use is identified. It's important to note that e-cigarette use is often not considered smoking. Asking the general question, "Do you smoke?" may not help you identify patients and families who use e-cigarettes. Instead, it's recommended to combine broad screening questions with specific examples, such as, in the past year, have you used a tobacco product, like an e-cigarette or a vaping device? Maybe a Juul or a vape pen? In addition to these screening questions, it's important to talk to families about the health harms of these products, especially for youth. Here are some of the resources available for quitting. There's My Life, My Quit, and youth and families can be referred by calling or texting Start My Quit to 855-891-9989. There's also a QR code and flyer available along with this presentation. For the Ohio Quit line, it's appropriate for adults over the age of 18, and they can be referred to 1-800-QUIT-NOW. And then there's the Truth Initiative, appropriate for youth ages 13 to 24 that can be referred by texting Ditch Juul to 88709. The Truth Initiative also have an option for parents. Parents of teens can enroll in their own support program by texting QUIT to 202-899-7550. Here is some additional information about My Life, My Quit. It is 100% free, confidential, and made for teens. There are several ways to refer teens to this program. The QR code below is available for download and is also available on a flyer if interested. Here are some great resources if you're interested in learning more. Here are the links to the info and resources included in today's presentation. Thank you so much for your time. We truly appreciate the great work that you do. If you have any questions, we can be contacted with the information below.